Good morning, everyone, and welcome to our session on Group A Streptococcus. I am Dr. Bharat Pankhania, Senior Clinical Lecturer at University of Exeter Medical School, and I'm also Health Protection Lead here at Southend. My job today is to make it as simple as possible. We're going to inform, we're going to educate, we're going to reassure you. And so what is Group A Streptococcus? Well, Group A Streptococcus is a bacteria. It's not a virus, it's a bacteria. It's a bacteria, and it can cause many different infections, ranging from nothing to your sore throat, to your skin infection, to the Scarlet Fever. Sometimes we have problems called rheumatic heart disease. Sometimes we have problems with your kidneys. So it's a long range of illnesses that this very simple bacteria can cause. And this bacteria has been around for a very long time. It's not that this bacteria has suddenly appeared. In the past, your grandparents will tell you, if you ask them, what is all this about scarlatina and rheumatic heart disease and all that, they will have come across it. So, as I say, these infections range from minor illnesses, and in very rare, it is usually very rare cases, it can sometimes become more serious. So here is the beast. It's a bacteria that is often found as a chain. So here you can see, a chain of little round spheres, and often it is as a couple of spheres together, Diplococcus, okay? So this is what it looks like when you culture it and grow it and then look under the microscope. And so commonly people will have heard the expression strep throat. What's all that about? So a strep throat is referring to a painful throat that may have been caused by an infection with streptococci. Having said that, in the age group that we're dealing with, in the age group that we are focused on at the moment, most sore throats are due to viruses, not bacteria. And the conundrum, and I'm going to come to that later on, the conundrum amongst us clinicians, us parents, and everyone is this viral? Is this bacterial? And that often takes a lot of energy to work out which one is it. So a strep throat is an infection in the throat and tonsils caused by Group A streptococci. And how do you get it? Well, Group A is very contagious. In other words, pretty easy to infect. And the commonest way to get infected by Group A strep is respiratory droplets. In other words, I'm talking, I'm singing, I'm shouting, and I'm in a closed environment, poorly ventilated. In other words, the classroom, or you're singing at the top of your voice because England is winning at the World Cup or something like that. It's those situations where it is what we call a super spreader event. When lots of people, poorly ventilated, you're in a room and everybody is shouting or talking, and that plume of bacteria-laden droplets comes from your nose, mouth, sneeze, coughs, etc. And by the way, it is not only sneeze, it's not only coughs, it is that speech. That speech produces an invisible plume of droplets laden with bacteria. And of course, you can also get it direct contact. What I mean by that is I sneeze on my school table, and then somebody else puts their hand on the school table, kitchen work surface, etc. And then you take your hand, and as a lot of young people do, this is the issue with young people, you see, they touch their face, their nose, their eyes, and they get infected. And for completeness, you can also get it from contaminated food. It's very rare. And with the reduction, with us, go it alone, Brexit, I hope we will remain vigilant about food hygiene, food standards, and not have food as a source of infections, other infections, including this one. what's this thing? Incubation period. It's so first you have to get exposed to the bacteria. And after you have been exposed, things may or may not happen. Depends on how many bacteria came your way, depends on your immunity levels. And so there are a number of factors. It's not like I was exposed, therefore I'm going to be ill. So you may get ill. That's the key word. You may. In many cases, you do not get ill, even though you were exposed. And this is a complicated concept for people to understand, but the key word is you may get infected. And if the may was going to happen, it usually takes 2 to 5 days after you were exposed to become ill with Streptococcus. So where do they live? The good bit is this, and I'll dwell on this later on, my final slide. The good bit is this. Humans are the only host. They do not live with animals. They're not in the animal kingdom. And these bacteria often live in the nose and the throat in some people, not all people, some people. And third bullet point is important, which is some infected people do not have symptoms, but they are still infected and they could be infectious. But the last bullet point is also equally more important for you, which is people who are sick with the strep throat. In other words, they are symptomatic, they're ill, they have a painful sore throat, painful neck, lymph glands, they have a temperature, they are unwell. Those unwell people are likely to be more infectious than people in the third bullet point who are not symptomatic. So as I have emphasized this before, talking, coughing, sneezing, touching something, and also last bullet point, infected sores on the skin. So remember, I said you have a range of illnesses with this bacteria. One of them is skin infection. So you can have, you can pick up the bacteria from an infected sore, introduce it to your nose and mouth, and you can get infected. So here are the important bits for you, for us, for parents, what to look out for. And I don't want you to say, Dr. Pankhania said, I need to look out for all of this before I say, oh, yes, I've got an issue here. You know, you look out for a range of this. So 2 or 3 of these signs and symptoms is steering you in the direction of, I need to consult with an expert and see if they need to be seen or assessed. Okay, so what are the signs and symptoms? And there are a few, so pay attention, please. Okay, so you have your pain, you have fever greater than 38 degrees centigrade, and no cough is a common finding. No cough, usually no cough. Okay, this is to distinguish it from virus. So this sore throat can start very quickly. Right, and you know, you have a painful throat, and you have pain when you try to swallow your food, your drinks, etc. And you have that fever, 38 degrees or so. And then look at the back of your throat, and you have this red, swollen, unhappy-looking tonsils, often with white patches, or even you may have streaks of pus on it. More on this later. And then also you may have tiny red spots on the roof of your mouth. I mentioned before, swollen, painful, tender lymph nodes in the front of your neck. And then you may also have other symptoms, which is the headache, stomach pain, nausea, vomiting, especially so in children. And then, of course, you may also go on to have a rash, and that rash we often refer to is at scarlet fever. Okay. Now let's take a little pause. Let's take a little pause and look at what a viral throat looks like and what a bacterial throat looks like. So to repeat again, if it is a bacterial streptococcal throat, then the sore throat starts very quickly. There's pain on swallowing. This is all rehearsing it again. Fever, red and swollen tonsils, sometimes with white patches, tiny red spots in the mouth. On the other hand, if it is a viral sore throat, repeat again, you have a cough, you have a runny nose, your voice, this is really important, it's hoarseness, your voice is sort of a bit labored, it's hoarse, and you have a pink eye, your eyes are a little bit injected. Okay. So rehearse it again. Maybe, as I said, it is a viral infection. How do you tell? Well, you may have a cough, the runny nose, the hoarseness, your pink eye. Okay. So let's focus on this rash that everybody talks about. So the first step is you get that throat, that painful throat infected with the bacteria. Then you get that, rehearsing it again, see, because this is important. And I say to you, you do not need the full family of signs and symptoms for you to say, doctor, I have a problem. 2 or more of these signs and symptoms equals you press some buttons and ask for an assessment. So you have this sore throat as the first stage. Then the second stage is a red rash appearing 2 to 3 days after stage 1 signs and symptoms. Okay, so the throat starts first, and then the red rash can appear. And what is this scarlet fever rash? Well, it's bright red, elevated red goose pimples, and it has a texture like sandpaper. So here's something. It's very distinctive. And by the way, you can tell a lot from this is if you were to press on this red rash, it goes away. You follow? It's not a hemorrhagic rash as such. It's your tiny blood capillaries that have dilated, and therefore when you press on them, the rash goes away. And in dark-skinned people, of course, it is a little bit difficult, but you can still see from this slide that, even in this dark-skinned person here, there is a little bit of a sandpaper-like feel to this skin, little goose pimples that even I can see sitting here. Then one more thing, I'm going to show you lots of pictures. This is good learning. It's really good to learn and be empowered when you learn. So what about the tongue? Well, it may have a white coating, bright red papillae, little spicules, and then later on it becomes that strawberry tongue, and then later on it becomes that what we call beefy tongue. Okay. So here, look, these are your tonsils on the left. You can see those white streaks. They look pinkish red, and the tongue also is looking a little bit red with white streaks. Okay, and then here is your beefy tongue. Yeah, looks, I call it the strawberry tongue, and you can imagine that, can't you? You can look at that and you say, you know what, yeah, it's a bit like a raspberry, like strawberry. Okay, I'm not here to teach you medicine. I'm here to look out for a few signs and symptoms so that you know what you're doing. And then, as I repeat, because this is important stuff for you, when you press on it, it goes away. And it starts off with the neck and then spreads to the chest, back, trunk, and then the extremities. And then after a few days, the skin starts to peel and fade away. And that peeling of the skin takes a week, and then between 5 to 25 days. So that scarlet fever can last a week. And this is important, the key bit in the middle. So spread of infection can be up to 6 days before you became ill. So this is where now we can see why you can generate a lot of cases, because even before you were symptomatic, you were passing on your bacteria to others, right? But the good thing is, as soon as I have started antibiotics, usually with the penicillin platform of antibiotics, after taking them for 24 hours, you're usually not infectious. But you must take your antibiotics for a full course, and the full course is 10 days. We give you it for 10 days so that you eliminate all those bacteria residing in your nose and throat and in your system. Okay. So look after yourself, look after us, look after everyone. If you are unwell, you don't go to school, workplace, etc. And you really must help us to help yourselves as well. I've repeated this: penicillin is the drug of choice. If you are allergic to penicillins, then there are other antibiotics. So fear not. Erythromycin, clarithromycin are the other antibiotics that I would use if I could not use penicillin. But last bullet point is important. So you feel better, you will be feeling better, but you still must take it for the full 10 days. Anyone can get infected. Some people are more at risk of this infection, i.e. at the extremes of age, the young people, the older people with other coexisting conditions. But without doubt, this is more common in children than in adults, most common in the 5 to 10-year-olds. It's very rare in children younger than 3 years old. And then, of course, parents get it, adults. So parents and grandparents who have a lot to do with little children. Yeah, now, how do we help you? So look, don't just turn up. Your first port of call is NHS 111. I have said this and I'm saying it again. We're almost there with my presentation, is this. I don't want you to just turn up, because the waiting room in the GP surgery may have a lot of ill people, vulnerable people, etc. So your first port of call is NHS 111, right? And then my last bullet point is really important. Don't sit on it. You as a parent, so I did a lot of pediatrics in my time, and parent knows best. Parent knows their child. And I often say to junior doctors whom I am training is, listen to the parent. Parent knows their child better than you do. So as a parent, I don't want to say NHS is closed, NHS is busy, etc., etc. You have 2 or 3 signs, the signs that we have rehearsed, and your child is not well, you press the button and you ask for help. But now I hope I have empowered you with, what are the signs, what are the symptoms to look out for, but don't sit on it. Your child is not getting well. We're here to help you. I don't want you to take that decision which says NHS is busy, I don't want to call them. If you are concerned, those signs are there, the signs are persisting, they've been there for a couple of days, then we're here to help. We're here to help, and despite the NHS being exceedingly busy, we know what to do. We will do the right thing for you. So this is my penultimate slide. So one thing, looking to the future is as follows. We will one day have good vaccines against Streptococcus bacteria. That will be wonderful. And when we have those vaccines, we know that we will have conquered one more infection that causes illness, sore throats, time off work, and anxiety. So let's hope that we get that vaccine. So my last slide here, I'm not going to play that link, but you will have this presentation, and you take this presentation and look at that first bullet point. This is an interview I did for local station in Bristol, and it's as relevant today as it was when I did it. And then I was just looking at other Streptococcus conversations and interviews that I have done, and I'm putting you a link on YouTube where I have uploaded some of my Streptococcus interviews on national media. So that's me done. I hope I have informed, educated, and empowered you. And we will take all the questions for you now and hopefully make it better for you.
That was brilliant. Thank you, Dr. Bharat. As interesting and informative as ever. I'm sure we could all sit here all day learning from you. So thank you very much for that. The first question here is from G, who asks, with the NHS 111 having a long backlog, hearing stories of over 48 hours to wait for a callback, how quickly should antibiotics be started? So I think you covered some of this in your presentation, Dr. Bharat.
Yeah, so of course, if I have a patient who is, in my clinical judgment, infected with a bacteria as distinct from a virus, then I want to give you antibiotics. Simple and straightforward as that. So you as a parent are the key. Your child is not well and your child is not getting better. I want them assessed. Simple as that. You don't just sit on it. You call again, you call your GP practice, and of course there is A&E. Your child is not well, you don't sit on it.
Thank you, Dr. Bharat. And Dr. Maimuna, did you want to add anything there just around you know, that entry point into support for people?
Thank you. Paul, thank you for that question. That's a very valid question. So like Dr. Bharat said, if you're concerned as a parent, then we would encourage you to seek support. However, there are some particular symptoms and signs you should look out for that really make you worried and you need to call 99 or go to your local hospital. So if you feel your child is not responding or is very agitated and irritable despite trying to soothe them, you've given Calpol, the temperature is still above 38, they haven't had a wet nappy for over 12 hours, or you're really concerned that they look very unwell, then you can call for emergency services or attend your local hospital.
That's great. Thank you very much. The next question is from Joanne, who asks, can you explain a little more about the link between Strep A and chickenpox, leading to more severe cases?
So I think both of us will answer this. I'll have a start first, and then my colleague Maimuna will also add to it, because this is important. So this is a really good question about viral infections predisposing you to other bacterial infections. So chickenpox is caused by a viral infection, and chickenpox per se, you know, whether it's chickenpox, influenza, SARS-CoV-2, whatever, these infections then predispose you. In other words, make you more vulnerable towards other bacterial infections. And sometimes, because when you've already had a beating from one infection caused by a virus, that bacterial infection can also be a little bit more aggressive in you. So when you've got chickenpox, you're already, you know, infected with something that makes you pretty unwell. And then you get introduced to group A streptococcus, for example, then you will be more unwell. And the thing we want to do is we can do what we can do. So in those circumstances, I want to give you antibiotics. I want to give you antibiotics as soon as possible, so that at least I can assault the bacteria with my antibiotics. With the chickenpox, usually we let it run its course. But the key point here is other viral infections make you more liable to other bacterial infections. So this is why I say to my other patients is, you don't want your seasonal influenza infection, because your seasonal influenza can also predispose you to have a pneumococcal bacterial infection afterwards, which can make you pretty ill. So one makes you more vulnerable towards the other.
Thank you, Bharat. And Maimuna, did you want to add to that?
Yes, I agree with Dr. Bharati. So research shows there is no direct link, or there is no, what is the right way to say it? So if you have chickenpox, doesn't necessarily mean you're at high risk to get scarlet fever. But what evidence shows is that both diseases tend to happen around the same time. So when we have an outbreak of scarlet fever and chickenpox, they tend to be aligned. So that means that you have a high risk to have the two infections together at the same time, which is unfortunate. But also when you have chickenpox and you're unwell, then your immunity is a bit lower. So you're more vulnerable to getting other secondary bacterial infections like streptococcus.
Great, thank you. And thank you for your question, Joanne. The next question is from Anne, who asks, is Strep A more dangerous of a concern for those on chemotherapy?
So I'm happy I can take that. So when you're on chemotherapy, unfortunately, we know that your immunity is at the lowest that you can ever be in life. And any infection, unfortunately, then you're at very high risk to be very unwell. So whether it's a virus or bacteria of any type, then you're likely to be very sick. And that advice is always that if you're on chemotherapy and you have a temperature, you have to attend hospital. So these are the times when you don't call your GP, you don't call 111. You should have direct access to your local hospital so that you're assessed and the right treatment is commenced.
Thank you, that's really useful. Did you want to add anything, Dr. Bharat, to that?
No, that Maimuna has clearly articulated that, when you are under chemotherapy, thank God not many children are, you are vulnerable. And same for an adult. You are, of course, in a vulnerable state because, we're giving you top bullets for cancer chemotherapy. And that makes you vulnerable. And such people would always have a package in place. In the words, should you develop illness, you are hotlined to having rapid access, assessment, and treatment if needed with your clinicians. Rest assured, these are few people, and we've still got all the facilities in the NHS to look after you. We will fight for our NHS to make it better in time.
That's great. Thank you both. The next two questions are linked, so I'll combine them if that's okay. The first one is from Sarah. If there is several cases of Strep A in a classroom of 5-year-olds, how many of them are likely to get it if 10 have had it already? So that's around the infectiousness of the illness. And then the second question is, how many cases in a school does there need to be for it to be called an outbreak?
Okay, that's sort of my business. So let me take you through the first question first, which is about 10 cases in a classroom. So it refers back to not everyone who is exposed gets ill. So it's not guaranteed that just because you've had 10 cases, the other 20 pupils, assuming it's a classroom of 30, are also going to get infected. But have they been exposed? My answer is yes, I think so. So if you have been in prolonged close contact, what is prolonged and close? I consider a classroom where there is onward transmission and you've already generated 10 cases. You're sitting together for several hours together. That's prolonged close exposure. So the answer is as follows. Have they been exposed? I think so, yes. Are they all going to get ill? I don't think so, because some people, depending on how much their exposure is and what their immunity level is from previous exposure to the same bacteria, then they will fight off the new arrival, the second arrival of the bacteria.
Great, thank you, Bharat. Maimuna, did you want to add anything at all?
No, I think Dr. Bharat has explained. I think the Public Health England guidance is if you have, I think, 2 children who are positive within a space of 10 days, I think schools are declaring. So if you declare 2 children within a space of 10 days, I think that's noted as an outbreak.
Yes, yes,
But
yes.
he's right. It doesn't necessarily, if 2 have, the rest of the classroom will have it. But I think it's 2 within 10 days.
Excellent, thank you. The next question is from Joanne. Can you explain any other common childhood illnesses that fall under the banner of Strep A?
Well, go on, you do, Maimuna, that you go.
Okay, thank you, Joanne. Just to make sure I understood her question, is she asking the symptoms or the common childhood illnesses? Because Strep A is a specific bacteria that causes sore throat and temperature and rashes, like Dr. Bharat explained. But unfortunately, the viruses at times present in a similar way. So the commonest presentation in children causing a fever and being unwell and sore throat is viruses still. So you can have, there are different types of viruses. The common one we see during the winter is something called RSV, which is commonest in the children under 3 years. And then Strep A is around the 5 to 10-year-old. But you can also still have chickenpox, like we said. You can have tummy bugs, so you can have vomiting and diarrhea, gastroenteritis, but generally doesn't cause a fever. But yeah, the commonest is still viral infections. So, and that's why it's very difficult at times for parents, but also clinicians, where do you cut off the mark? So some of the things we tell parents is if your child has a temperature above 38 after 5 days, again, you need to seek medical attention, because generally we know viruses temperature should stop within 3 to 5 days. So if they're still having a high temperature after 5 days, you're still worried about them. Even if initially we said it is viral infection, they want on antibiotics, then you should seek medical attention so that they're assessed.
That's brilliant. Thank you. Joanne, did that answer your question?
It did. I also meant things like impetigo and things like that that can be quite common childhood, especially after chickenpox and stuff like that. So.
Yeah. So so Strep A causes the commonest symptom or illness it causes is sore throat or tonsillitis, but can also cause skin infection, so impetigo, but can also cause complications. So you can have a pneumonia from streptococcus, and you can also there's something else it causes, but mainly skin infection and sore throat. So impetigo, the rashes that are crusting, look pussy around the lips or the face, those can be caused by streptococcus. And then in fact, complications, which are very rare, thankfully, is the pneumonia and the bloodstream infection.
Thank you, Doctor and Joanne. I think, Dr. Maimuna, this one might be for you as well. It's a question from G, which is, can some pharmacists test for Strep A and or prescribe antibiotics?
Thank you. That's a very good question. So there's been a lot of discussions around, because we've had, and this is valid, we know that the public is very worried. We know that parents are very concerned. So anything to do with child death, both parents and clinicians, we are all worried because you don't want to miss that one child that you could make a difference. And there have been lots of discussions around whether pharmacists should give antibiotics. I think in some areas it's been approved. So if the child meets all the criteria, pharmacists are giving antibiotics. In some areas it's not yet. And the reason for that is we've done a lot of very good work in the last 10 years around antibiotics and giving antibiotics for the right condition, because we know there's resistance and not using antibiotics irresponsibly. So I think people are still aware that we have to be careful, but also make sure that we are treating the right condition with antibiotics. So I think some areas pharmacists are giving, some are not. I don't think in our area in Southend that pharmacists are giving antibiotics yet. I don't know, Dr. Bharat.
Yeah, so it's a prescription only medicine, and it isn't a case of you turn up at the pharmacy and it's going to give you your antibiotics. We have to be careful, not because we want to be awkward, please bear with us, but it is important that we don't mess up our very valuable antibiotic and create the emergence of resistant bacteria. At the moment, penicillin platforms work really well, and the antibiotics ought to be given out as the protocol indicates, which is a clinical assessment followed by give the antibiotics. But what has been allowed from the local pharmacies is there was a run on liquid amoxicillin and shortages, and there have been granted authority permission to give it in other formulations if the child will take it. So it's i.e. the tablet form, etc., crush the tablet, etc. In some places, in some parts of the country, there has been a shortage of liquid amoxicillin.
Thank you. I'm going to bring Margaret in because she has a hand up. She's from the public health team here in Southend. Did you have anything to add to that point, Margaret?
Yeah, just to say that and to reassure parents that Southend, compared to our geographical neighbors and beyond, fortunately, we haven't had any hospitalization or death, and therefore we're reviewing the case. So in light of that, everything is being monitored and managed to respond appropriately. So listening to parents, watching the data, looking at the statistics, and seeing when to come in with extra measures if need be, like pharmacists or GP opening their services more so that they can be so that parents can access them ASAP. So watch this space. But the good news is, compared to our geographical neighbors, statistical neighbors, we have had no hospitalization, deaths, or serious things, and we don't want that to happen. So if that's helpful.
That's very helpful. Very helpful and reassuring. Thank you, Margaret. I'm going to go back to the questions in the chat. We've got just over 10 minutes left on our call today. Sarah asks, what's the scientific reason behind the rise of Strep A and Scarlet Fever? Children were less susceptible to COVID, but now we're seeing a big, it says here, a high increase in the spread of Strep A and Scarlet Fever with children. So her question is, sorry,
let me have a go at this, and then my colleague can also add from her perspective. So, yeah, it's interesting, but what I want to re-emphasize again is this isn't a case of your immune system is not working because of lockdown. That's the one key important point. The second point is this: we have several viruses out there in circulation, which then predispose you to bacterial infections. Then my third point is group A Streptococcus is infectious and it is easy to spread. So we have a perfect storm of lots of viruses out in circulation, number one. Number two, infection control measures like we had under COVID are not in place anymore, like your wearing of masks, ventilation, etc. The IP infection control measures are much reduced. And then the third point, which I did touch on in my presentation, is not everyone who is exposed gets infected because they may not get enough bacteria or they may have pre-existing immunity. So this takes me to the explanation as well, which is we've lived through extraordinary times when we were isolated. So that small number of people throughout the year who were going to meet Streptococcus, get the infection, get the immunity, never did. And then en masse, the bacteria is circulating, especially during the winter period, and they're all getting their infection together rather than gradually, as happens in normal circumstances. So you have a large vulnerable population, meaning they haven't encountered it recently or they haven't encountered it at all. And then they all encounter it at the same time, simultaneously. And then that figures mathematically and scientifically about, I see how you can suddenly create a spike. So you need that ingredient of not exposed, not immune, therefore vulnerable, and the bacteria is in circulation, and bang, you all get infected. And not everyone who gets infected goes on to develop scarlet fever. But if, let's just take hypothetically, say 2% go on to develop scarlet fever, then 2% of a large number of people with their sore throats, where they've all got exposed recently because they hadn't got any immunity, 2% of a large number is still a large number of people who become ill. So there's no conspiracy, no like we've harmed your immunity or that there is something else going on. Of course, there's one more bit, and we're also working on this, and I know we are, is ascertaining, have we got a more disease-causing strain of the bacteria in circulation? We don't know. We don't know at the moment, but we're also looking into that. So I hope that's a really lovely question, and it's a pleasure to be able to answer it and hopefully reassure, educate, inform you with the thoughts behind why we are suddenly seeing lots of cases.
Great, thank you, Dr. Bharat. Dr. Maimuna, would you like to add anything to that?
No, I think Dr. Bharat has articulated well the answer. Yeah, I'm happy.
Perfect, thank you. Thank you for that question, Sarah. I can see one more question in the chat from Sarah here. Maybe this one's for you, Dr. Bharat. Does a child need to have a temperature continuously for it to be scarlet fever if they have had some of the other symptoms?
No, because it all depends. You see, usually if you are ill with a bacterial infection, you are going to maintain your rise in temperature. But I know life is never straightforward. So my answer is as follows. Yes, maybe, but maybe not. So it is not guaranteed that your child is going to have a temperature and keep that temperature all the time. They may have what we call spikes of temperature as well. So it can be a bit of both. Human beings don't follow a textbook or a computer. That's why we're humans. So your child, in answer to your question, is yes, they may have a sustained temperature, but remember, you may be giving them Calpol, tepid sponging, etc., which brings the temperature down. Calpol and all that wears off, temperature goes up again. So it doesn't have to be continuous. It may also be spikes. But the key point, this is really good. The key point is my child keeps on having a temperature. That's the key point. You see, normally when you're fit and healthy and well, you're not going to be spiking temperatures or maintaining a high temperature. But if you are spiking temperatures or keeping a high temperature, that's telling you something. My child is unwell.
Brilliant. Thank you, Dr. Bharat. Margaret, is that a new hand? Would you like to come in on that?
It's a new hand.
Yeah.
Just to say, just like Bharat referred to earlier on, because with scarlet fever, it's the older children, like five and above. And also my colleague, Dr. Mushabe said. And the good news, I think, is that because the children have broken up now for winter holidays, that therefore the spread or the exposure will be reduced. So we are hoping that actually going forward now, there's going to be a downward trend, but to bear in mind, however, that we should still make attempts to prevent the spread. I know there's winter out there, but if ventilation will be helpful, reducing contacts, and more importantly, to help the wider population, staying away from immunocompromised people, the elderly grandparents, the pregnant women, the Christmas parties. Let's be sensible, let's be careful. It's going to help young people because they've broken from school, but then don't let it spread in the community, because that was what happened during COVID. Schools broke up, but then it spread in the community. We can be sensible and just control it all around. Thank you.
Thank you, Margaret. Really important points there and very useful. Thank you. I can see that Joanne has snuck one more question into the chat. So if we can just cover that one and then we can start thinking about closing. Dr. Maimuna, did you want to come in on that question?
Yeah, that's fine. I'm happy to come on to that. Thank you, Joanne, for asking that question. So yes, it is safe to give alternate paracetamol and ibuprofen. So we say paracetamol 4 times a day, so 6 hours apart, and ibuprofen 3 times a day, 8 hours apart. So what I usually advise parents is you give one. So you could give paracetamol, give it 45 minutes to see if it acts. If the temperature is still high, then you can add in the ibuprofen.
Excellent. Thank you very much. So I'm going to pass over to Dr. Maimuna and then Dr. Bharat to close, but I'd just like to say thank you for all of you joining us today. I think it's been a really useful and informative session. I always learn lots. I do think that the 2 doctors should maybe start a podcast or something. I think you worked really well together. Just throwing that out there. A radio show maybe. Thank you very much to Simon for all of the information that he's been sharing throughout the session. Thank you to Juliet for keeping us all in line and making sure we were doing our jobs today. And thank you all for joining us. Dr. Maimuna, if I can hand over to you if you wanted to say any final words, and then to Dr. Bharat.
Thank you so much, Roger, for supporting with this. I would like to thank everyone who attended. And I think I would like to reassure parents. I'm a parent, I have 2 kids in school, so I know the anxiety going around and the fear. But to reassure people that actually Streptococcus has been around for a long time. Generally, children get very mild illness, but if you're concerned that your child is unwell, then it's valid and you should seek medical attention. If they have a high temperature, above 38, if they're still drinking a little bit but less than usual, they have a sore throat, you can call your GP, you can call NHS 111. If they look really unwell, they're not responding, or they're taking longer to respond, they haven't had a wet nappy for more than 12 hours, or you're worried as a parent and think actually they look unwell because you know your child best, please call 99 or come to hospital and we'll see them. And I know there's a lot of pressure all around, but we are still here. Our doors are open to see you guys. So please don't hesitate if you're really concerned. Thank you.
Thank you. And Dr. Bharat, if you'd like to close.
Thank you. So I was reflecting on my presentation when I was putting it together last night, and my last slide has a link to a TV interview I gave, God knows, 5-6 years ago. But all the stuff that I said then is relevant today. And it only takes, I think, 3 minutes. So it's a really good summary of, what is Strep A, what to look out for, what it does, etc. So you will have this presentation, go to the last slide and click on that link, and it will summarize everything that we've talked about this hour. And my final words to you are, fear not, but don't sit on your child. If they're unwell, act sooner. And I, as a infection prevention, health protection expert, am looking forward to the day when we have effective vaccines against streptococcus. That will happen, that will come, and that will also be a really good day. In the meantime, all the other vaccines which are there, they protect and they keep your child and yourself healthy and well. Always take up all the offers of all the vaccines that are available. They are our best tool in keeping us safe and healthy. In fact, 50%, just think about this, 50% of us would not be around were it not for the vaccines that we have. And so vaccines save lives. Make use of all the vaccines that are available for you and your children. Thank you.